So EAPM is very much based at the European level. So we have brought this multi-stakeholder approach at the European, working with the Commission, the Council and Parliament. Now we're taking the next stage, going to the national level. Health is very much a national competence, so we're forming networks of stakeholders to shape the environment for personalised medicine at the European level.
Italy must lead with the new projects of the Human Technopole, with Genomics, Omics, and the big research we are doing overall, starting from Milano. These new frontiers of research and science for the patients.
We had a meeting today in Milan about personalised medicine. Can you just tell us the key outcomes from the meeting?
I think firstly the Italian presence and commitment to EAPM has been clear from the beginning. We've got Angelo Paradiso, we've got Paolo Casali, we've got Giovanni Martinelli, we've got me from IO, now from IFOM. Gabriele Pravettoni has been pushing the patient empowerment story from the beginning, and of course Francesco De Lorenzo from ECPC. So there's always been a critical mass of Italian supporters, and today we rehearsed the sort of plan, the agenda, the forward predictions and actions for the European Alliance, and put them into an Italian setting. The bottom line is that there's total agreement within the Italian community, the key holders, the stakeholders, the holders of the intellectual argument for sure, if not the purse, are all in favour of putting together an Italian network which will promote the personalised medicine agenda and will interlink with the EAPM in Brussels. So I think that our mission is accomplished.
People need to realize that the paradigm under which we have operated for the last 70 years, that is the one of the cytotoxic, is no longer usable for precision medicine, and that we need to change.
In Italy, we tried to find out exactly how much time the Italian agency for the price takes for new drugs. And we made a study, and we found out that for some drugs, the innovative one, those that are higher cost, there might be also 500 days, with an average of 500 days. So that means that is a bureaucratic barrier to allow patients to have the right medicine, the right moment, and the cancer is not in the condition to wait for the time that bureaucracy takes to allow to this medicine. So we are working, and in Italy we succeeded to get approved also laws that oblige the Italian agency to go much faster.
I think one of the biggest challenges we face is around market access for molecular diagnostics. In many countries there's not defined pathways, there's not specific HTA assessments. Often it's done not even at a national level, it's done at a very regional level. So it's not clear how you bring your technology forward. What is the evidence requirement? It's not always very clear what evidence are required for diagnostic. So really, as a small company, you're not really sure which pathways to go through, which really inhibits investment and the ability to bring, a test to market.
So I think the important thing in healthcare genomics is it's a fundamental diagnostic of diagnostics for personalised medicine, and really it's understanding from our point of view how this applies in different member state countries and how we can help coordinate across the EU to start bringing personalised medicine and the great potential that has to reality by understanding what the main roadblocks are in different countries and look for the consistent themes that are important, such as defining standards, understanding problems around data privacy and questions around data privacy, but balancing that with the benefits of data sharing, understanding medical education, public engagement. So working across a number of areas really to try and take things forward to bring genomics and personalised medicine to health systems across Europe.
and patient data are difficult to access and to exchange, not only when we are talking about clinical data or genomic data, but also for imaging. So one of the major efforts that we would like to see and we would like to support is to have the possibility to share and collect imaging data and link those imaging data with clinical and genomic data in order to have, let's say, patient files, complete patient files, including imaging, available throughout the country.